everyone. My name is Dina Ezagui. I'm a trained pathologist. I practice, mainly see children in early intervention population.
When we treat children with feeding disorders or feeding delays, we always have to keep in mind that the anatomy and physiology of swallow mechanisms are not like adults. If you ever need to see a speech therapist for your child, if you're referring a child to a speech pathologist, make sure that they're a pediatric therapists and they're trained to treat children. They really need to know what they're doing when it comes to feeding therapy, so keep that in mind. Okay, so what are feeding problems? I just listed a few. Inadequate caloric intake resulting in failure to thrive. Crossing the second line of standard deviations on the growth chart. Crossing this is considered failure to thrive, which is between 3rd and 5th percentile. Weight loss below 3rd to 5th percentile. Food refusal. Bottle dependency. So sometimes I get a referral, my child is not eating enough, I don't know what to do, I don't know how I can get my kid to eat solids. It happens sometimes, but recently I had a client, the service coordinator said to me, the mother is really having a hard time, child is not eating anything. I went in and I asked the mother, tell me what the kid is taking by bottle. Basically, this child was drinking milk all day and all night. So if a child is going to be bottle dependent, they're not going to eat. Pharyngeal dysfunction, coughing, choking, and gagging, vomiting, sometimes due to reflux. What is reflux? It's a backflow of stomach contents up to the esophagus.
This is the opening of the stomach. It's called the lower esophageal sphincter. This is the upper esophageal sphincter, and this is the lower. When there's weakness here, that acid backflows all the way up to the pharynx, which is the throat. This is the mouth, this is the nasal cavity, this is the oral cavity, which is the mouth. Swallowing happens here. I'm going to talk about the phases of swallowing and you'll understand a little better later, but it happens here. So choking and gagging happens here. Reflux has nothing to do with choking and gagging.
So sometimes we get kids that we kind of see some signs that there's reflux going on and we refer them to the pediatrician. But sometimes we get them, they're so selective and so behavioral, but the underlying issue was resolved, but the behaviors are still there, so we have to address the behaviors. We have to kind of determine if we feel that there are still underlying issues going on, we should always refer them to the pediatrician.